student, and this is part of my assignment. So what we're going to be discussing today is COVID-19. So we're going to dive into it. We're not going to go into much detail. We're not going to go into much detail with it, but it is going to be a participative session where I'm going to ask questions during the session and after the session. So please do pay attention and engage as much as you can. And as I've mentioned, I'm not going to have my camera on during the presentation because my network connectivity is bad where I am. So I'm going to switch off my camera, but for the rest of you, you're more than welcome to have your cameras on. And if you do want to ask questions or say anything, please do unmute because I might not be able to see your hand if you raise it. Okay, thank you. There we go. Okay, let me just share my PowerPoint presentation. Okay, there it is. Okay, can someone please just confirm for me if they can see the PowerPoint presentation? Is it displaying on your side also?
Yes, it is.
Okay, great. Thank you very much. Okay, so like I mentioned, today we're discussing the coronavirus 19, which is also known as COVID-19, which is currently a global crisis, a global pandemic all over the world. So I just wrote something here, very brief, pertaining to the virus. So at midnight on the 26th of March, the official 21-day national lockdown began. SANDF troops and SAPS, which is the South African Police Services, were deployed into the streets as a way of protecting us. What we knew as normal changed, and we had to quickly adapt to a new norm, a norm of isolation, of physical interaction, and not being able to leave the house. March 2020 changed the lives of so many South Africans and people around the world. We remained behind closed doors, no morning walks, no drives, no going to work. You couldn't meet up with our loved ones or leave the house for no reason. For our own health and protection, being isolated was safer. And I think some of it still applies to date. So we're going to start this presentation. We're covering a few topics today. So you'll see them and I'll go through them as we go through the presentation. So the first thing I'm going to answer today is, the first thing I'm going to be looking at is what is COVID-19? So basically COVID-19 is a virus, right, as we know it. It was an infection caused by the SARS-CoV-2 virus, which is part of the COVID-19 family, which I'll go into a bit more detail as I go through the presentation. It was established in China, Wuhan, China, in December 2019, and it has spread around the world, hence the term global pandemic. And it has changed people's lives for, I don't know, I mean, it has affected us differently. We can't all relate the same way to COVID-19, but it is a problem that the world has been facing for the past 2 years. Let me rather put it like that. So when I say it is an infection caused by the SARS-CoV-2 and comes from the coronavirus family. The coronavirus family is a family of viruses, basically, that affects your respiratory function. So anything to do with your breathing, your speaking, like your function to your mouth and your eyes and your mouth, your respiratory functions, it affects that. And it is spread through droplets out of your mouth or nose, either when you breathe or you cough or you sneeze or you speak. And I think a lot of people are well aware of the different ways you can spread COVID-19, but basically it is to do with your respiratory function. Now, there are different symptoms when it comes to COVID-19. Here I made a little note that individuals with COVID-19 have had a wide extent of indications detailed, extending from gentle side effects to extreme alignment. Side effects may show up 2 to 14 days after the introduction to the infection. Anybody can have gentle to serious indications. Individuals with the following side effects may have COVID-19. So when you experience the symptoms, it does not necessarily mean that you have the virus, but you might, because there are symptoms that are aligned with the virus, because it can just be a normal cold or a normal flu, but these are the symptoms that come with having COVID-19. So you may experience a fever or some chills, maybe coughing, shortness of breath or difficulty breathing, fatigue, which is tiredness, muscle or body aches, headaches, new loss or taste of smell when you can't taste anything, sore throat, congestion, a runny nose, nausea or vomiting or diarrhea. Now, these are some of the symptoms that come with COVID-19, and people have different experiences and symptoms when it comes to the virus. You can have all of them or you can have some of them, depending on your immune system and depending on the type of person you are and your health. So these symptoms usually show up 2 to 14 days, but some people are asymptomatic, meaning that they do not have the symptoms even though they do have COVID. So it depends on our immune system and who you are, basically, in terms of your health and where you are in terms of your health, like I mentioned. Now, this is where you get to interact. And I'm going to ask that you unmute because I cannot see your hands as you raise them. Let me try that. Okay. So what to do next, right? Now, should you experience any of these symptoms? Now, I'm posing this question to you as participants. Should you experience any of these symptoms, what should you do? Now, personally, or what have you done in terms of someone that has been or has thought they were infected with COVID-19? So when you experience these symptoms, what have you done as a person, or what have you advised someone else to do? So this is going to the participants, and I'm giving the floor to you. Okay, Patience, I see your hand, so you can unmute and just tell us.
So, in the event that someone that I know gets COVID-19, what I would advise is that the first thing to do is obviously to self-isolate so that you don't infect anyone else. I would
Yes,
advise that first go do a test, maybe a drive-through test, a PCR test, I think, or you
yes,
can go to get the full-on test, because sometimes you could get symptoms, but it could just be a general flu as we are
yeah,
experiencing the winter season. But yes, first isolate. If it's serious, go to a hospital and get hospitalized, because then you can't be in self isolation if you're experiencing shortness of breathing or you are having serious chills or a heavy flu. So, yes,
yes.
the first thing would be self isolate. If it's serious, hospitalize yourself.
Okay, thank you. Thank you very much, Patience. That is actually very accurate. Is there someone else who would like to share what they have done or have advised someone else to do who has experienced the symptoms before I continue? Going once, twice, and okay, I'm going to move on. I don't want to keep anyone. Okay, Liabona, can you please share?
Okay, so personally, I've had symptoms of COVID. So what I've done was to notify the people who were around me, and then immediately went into isolation, and then I had to go and test for COVID. So the same thing that patient referred to, that immediately when you see yourself that you're having any symptoms, is to isolate yourself, and maybe also go to any hospital or clinic or any service provider that provides the testings, and then conduct the test and then wait for the results to revert back to you. That's what I did when I experienced symptoms of COVID.
Okay, thank you. Thank you very much. Thank you very much, Liabona. I appreciate that, which is also very accurate. So the next slide here speaks to some of the things that you can do when you experience the symptoms of COVID. Now, I've broken it down and you'll see why. So the first one is stay at home, separate yourself from others, which is isolation, or some call quarantine. Call your doctor if you do have a personal doctor. Follow your doctor's instructions and monitor your symptoms. Now, this is for someone who has had a doctor come into their home or their space and tell them, okay, this is where you are, stay at home, isolate, take care of yourself, and here are some meds, right? So for someone that does not have the luxury of having a doctor come in, you can still do all of those things, like stay at home and isolate from other people, follow your doctor's instructions, but also you can go get tested, which is what has been mentioned here. So basically, you go to your hospital, your clinic, or any service providers, because I know that some of them do provide drive-throughs or whatever to get tested. But when you do go and get tested, you need to ensure that the safety of other people, which is very, very important because COVID does not affect certain people, it affects everyone. And for you, it might just be mild symptoms, but for someone else, if you affect them, then it might become worse. It might even lead to death. So when I say that you ensure the safety of other people, it's making sure that you're not around too many people. You're always wearing your mask. You're not interacting with a lot of people until you have gotten your test results back. So we need to make sure that other people are safe as well, not just yourself. Because I mean, we live in a global pandemic right now. You know, everybody has to think of the next person, and we all have to be mindful of our surroundings, especially when it comes to this virus, because it has affected a lot of people. So thank you very much to Liabona and Patience for their opinion on the matter. Now, moving on is COVID-19 testing. Now, here I've identified two types of COVID-19 testing, which is the rapid point of care test and the laboratory test. Now, when I speak of the rapid point of care tests, now these kind of tests are performed or they're translated by someone that is not the person that is being tested. Now, they can be performed in minutes. You do get some of these rapid point care tests that you can buy now and test yourself at home for those people who are uncomfortable going to the clinic or waiting in a long queue to get tested by someone else. They do call these self-tests. They are fast tests that can be taken home or any place. You can do the test anyway. It's a mobile test, and they are simple to utilize and they produce quick results. So these rapid point of care tests are tests that you can take anywhere, basically. They're very fast and they produce quick results. So it's easy to use, basically. It's convenient for a lot of people because sometimes you do not have COVID, you just feel the chills and you just want to be safe that you are not going to be affecting or making the situation worse. And then you have your laboratory tests. Now these can take days to complete and include RT-PCR and other types of NATs, different types of lab tests. So these are different types of lab tests. That is where they put the swab in your mouth or your nose to get DNA, saliva or DNA, and then they test it. I would say in my personal experience, I think your laboratory tests are the most accurate. They do take longer, but they are the most accurate tests that you can do in terms of COVID-19. And it's very important to understand your option when it comes to the test, because as much as I'm saying that they're accurate, the lab tests are accurate, for some people it's very uncomfortable. So maybe someone else prefers the rapid point of care test or the self-test that you can buy. I don't know, I'm not sure how much the test costs, but I guess that it becomes much easier. I'm sorry, I think there was someone that was joining. Okay, there. Okay, so as I mentioned, there's these two types of tests. You choose which one you want. Sometimes it's not optional depending on your pocket, obviously. The lab tests you can get anywhere. Private facilities do charge you, and I think the max that the government has put is 500 rand. So nobody can charge you more than that unless it has changed with all the different changes in prices that are currently happening because of fuel and inflation. And moving on, now this is another question that I'm posing to the audience. So let's say, and I say this again, God forbid, because we don't want any people testing positive for COVID. You test positive for COVID, right? Now, what do you do next? Now, I have three options on the right-hand side that I want you as individuals to choose from. Now, this is what people tell you to do. Choose your favorite. What is positive? Now, the first one is tell every individual that you meet on the way home that you tested positive and ask for a comforting hug. Or go straight home and follow your doctor's orders. Or my personal favorite, throw yourself a party to celebrate life. So I'm just going to escape again here and I'm going to go to my teams and I'm asking you. Celia Buena's hand is up. Can you please share what would you do choosing from the list? Let me display the list again. There.
No, I just want to ask first, are you displaying your screen because I don't see the PowerPoint slide on my side?
Okay, I'm sorry. Does everybody else not see the screen? Let me do that. Can you see it now?
Yes, yes. Thank you very much. Now I can see it.
Okay, so based on those three things that you see on the right-hand side of the screen, right? God forbid you test positive for COVID. Which option would you choose? So the first one is tell every individual that you meet on the way home that you tested positive for COVID and you ask for a comforting hug. Or you go straight home and you follow your doctor's instructions, or you throw yourself a party to celebrate life. This is your own personal opinion. Which one would you choose? Number one, number two, number three? Okay. I'm gonna go back here because I cannot see. I see Patience has her hand up.
So on a normal day, I would like to throw myself a party to celebrate life. However, COVID-19 is a very serious virus. Therefore, I would go straight home and then follow my doctor's instructions so that I do not spread the virus to anyone else, my friends or my family or anyone else that I'm likely to meet on my way home, and then isolate until I have further instructions from my doctor.
Okay, that's Patience. Thank you very much, Patience. Is there anyone else would like to share? What would you do personally if you were told that, okay, you have now tested positive for the virus, choosing from the three options that I'm hoping you can still see somewhere? Anyone else who would like to go? Okay, I'm just going so that move around it. Okay, moving on, seeing as there's no one else. Personally, I feel, like Patience mentioned, that throwing myself a party would definitely be the go-to thing for me, to celebrate life. But you are right. We need to be mindful of other people. So going straight home and following your doctor's orders would probably be the best choice to ensure that everyone is safe. Okay, just to confirm, can everyone else still see my screen?
Yes, I can still see your screen on my side.
Okay, that's great. Okay, now moving on to the effects of COVID-19. Now, COVID-19 has affected us differently, like I mentioned in the beginning of the presentation. We haven't been affected the same ways. For some, it was easy. For some, it was hard. Some have lost people that they loved, people that they knew, But believe it or not, there is not only bad stuff when it comes to COVID-19. And I think the more you look into it, you get to see the good stuff as well. So I've made a list of disadvantages and advantages that have come with COVID. So I'm going to be reading through these lists, but the next question after this is going to be asking you as participants, how has COVID-19 affected you? So you can share a brief story of how COVID-19 has affected you, be it in a good way or a bad way. But I'm going to first go through the list and then I'm going to give over to participants to just share how they've been affected by COVID-19, and you don't relax on the bad stuff because there is good stuff too that has come with COVID-19. And you're more than welcome to contest some of the stuff that I have in front of me because maybe it doesn't work for you. So starting with the disadvantages, there was lockdown, and I think we can all agree that no one enjoyed that. Due to COVID-19, people have lost a lot of people due to COVID-19. There's been sickness and ill health during COVID-19 and after. So whether or not you have tested positive or not, it has affected your health in some way. The global pandemic, which caused the disruption all over the world, is really not helping, because I was starting to think we were picking up. And then there was an economic decline. Just businesses started going down, especially with the lockdown that was implemented. Businesses started going down. Currencies became weaker, so there was an economic decline in literally everything. Unemployment rose, and I think South Africa is actually at its highest than it's ever been now, at 43%, I think. Please do correct me if I'm wrong. People have been retrenched from their jobs. Companies have shut down. I know that Greyhound shut down during COVID, but now I think they're back into practice. So that's a good sign. It means that people got their jobs back, or people got employment. There was hunger during COVID. I mean, hunger has been a part of South Africa for a long time, but I think with COVID and everything around COVID, it kind of made it worse. And I think the most common one was depression, especially if you're an outgoing person, because then you're stuck. You don't know what to do, when to do it. You've been told where you need to be, how you need to be. You need to wear a mask. You need to isolate, maintain social distance. So it might have caused a bit of health problems for some people, because we don't handle situations the same way. And then I have a list of advantages. And again, you're more than welcome to contest or protest against what I have to say. It really, to a certain extent, there was technological advancements, seeing as we couldn't be outside and outgoing. People moved more to the technological world. There was advancements there. A lot of people started understanding the value of life. And I'm hoping maybe this is something that we can all relate to, because when you're being told that people are literally dying, thousands of people were dying every day, I mean, all over the world. So it kind of gave you a sense of appreciating life. Creativity for home living and surviving. And I put alcohol and bonding games there for a reason, because in terms of creativity, during COVID-19 we had the shutdown, and you couldn't sell alcohol because, well, I mean, it didn't make the situation any better. And then people started making their own alcohol, which for me was very creative, because I mean, yeah, we got creative during COVID. People made their own home games, alcohol, different types of things people started creating to make their living situation a bit more tolerable for themselves and for their families. A lot of people started discovering new business ventures. I think I am one of those people, considering the fact that we are still in COVID technically. Adapting to a hygienic life. You're washing hands, sanitizing, making sure that your space around you is clean. So people had to start being hygienic a bit more and be a bit more cautious when it comes to their hygiene. A work-life balance. Now that doesn't apply to everyone, but working during COVID, maybe it would apply more to them, because then you had time to work, but also you knew that you needed to pay time to your family and the people that were around you. You couldn't be on your laptop or your PC the whole day. And then reduce pollution, because people were stationed in their homes. So you weren't going outside and throwing stuff outside, or air pollution with your cars and whatever. So people, the rate of pollution actually decreased. So those are my effects of COVID. And like I said, I was going to ask you as participants to share how COVID-19 has affected you. So I'm going to minimize my screen there and go to the participants again to see, so that you can provide your input, how COVID-19 has affected you personally in any way, be it good or bad. So I'm just going to give the floor to you guys. We're almost done, I promise. How has COVID-19 affected you as an individual? Anyone, you can just unmute.
Okay, I'm unmuted. Good afternoon, everyone.
Afternoon,
so
Enver.
In my case, I mean, the industry that I work in is the tourism industry. So I mean, our industry got battered, completely battered. I think our borders was closed for 7 months in total, and the operation or the business I work for, we were closed for 7 months. So basically, I mean, there was no income for 7 months other than what the government provided. So yeah,
Yes.
so it did affect me negatively.
Yeah. Okay. Thank you. Thank you very much, Enver. And I hope now with things picking up that your industry is starting to look a bit better than it did during the pandemic. Is there anyone else who would like to share how they were affected by COVID? Liabona?
Okay, so with the advantage that you had where you said it improved work-life balance, personally, I believe that maybe instead of improving on my side, it was just like a negative impact, because now I have to like work from home, and then working from home obviously enables me to work extra hours or maybe work longer than the hours I'm supposed to be working, and then I end up not having to enjoy my own personal life, but rather focusing on work life. So that's just my input on that.
Okay, thank you. Thank you very much, Liabona. Yeah, totally. I totally get what you're saying, because COVID has affected us differently. But for me personally, the beginning of COVID was not that hard, because I remember telling my family that by the time the president announced lockdown, I was already on lockdown. Because, I'm always at home. I don't see a reason why I should go anywhere unless I really, 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 really have to. So when COVID hit for me, it was like, oh, yay, now I get to stay home without having to explain myself to anyone, basically. I'm a very positive person in terms of not really focusing on the disadvantages of COVID, because then I'm just going to drive myself crazy. But there were disadvantages, like getting used to attending online was, I think, one of the hardest things we've had to do. But now I actually prefer it that way, because going to campus is just a waste of money. But yeah, like I mentioned, the virus hit us differently, and I'm just hoping that now that everything is starting to pick up, we all get better in terms of health, mentally, physically, in terms of money, our jobs, and we just start looking at the world differently, I guess. Moving on, please do tell me if you cannot see my slide, because I am on the slides now. Moving on to how to protect yourself from COVID-19. Now, this one is again different for each and every individual, depending on what you deal with every day. So I'm going to go through my list. The first one I put there for a reason, because it's sensitive per person. Not everybody believes in the vaccine. People have the different opinions in terms of vaccination. And if you want to share yours, you're more than welcome to unmute, and then you can share your opinion. The first one is get very up to date with vaccines. Now, there's also a booster for vaccines. So I know there's the Pfizer and the other one that I had. Okay, the name is gone now, but there's two of them. And then there's the booster that you can now get. An office mate of mine actually was supposed to go for hers. I personally am not against vaccines, even though I do not care for me getting one. I'm not against it, because we all have different opinions of how to handle day-to-day situations. It is mandatory, let me rather use that term, in certain companies to be vaccinated, because then you're protecting other people. Because let's face it, we're not living alone in the world. So what you may see as unnecessary and wrong and against whatever does not necessarily apply to the next person. I'm not sure if someone unmuted and wants to say something. Okay, I'm just going to move on. And then, sorry. And then wear a mask. Yes, no, the president announced that we don't have to wear a mask outside now, which is a great thing. I really can't breathe with the thing, and I have a lot of respiratory functional dysfunctions. Let me not put it like that. maintain social distance at least 1.5 meters. Now that applies differently to different people. And I say that because I travel with a taxi to and from work, and there is no way I am maintaining social distance in a taxi that is supposed to sit 15 people, but then we end up being like 20 or 25 people in the taxi, you know. But wearing a mask and then I guess kind of helps in the sense that at least I'm protecting myself some way. Avoid poorly ventilated spaces and crowds if you can. It depends on where you work, the type of environment you have at home. Wash your hands often. That one still applies. I do recommend people using a lot of hand sanitizer, even though it kind of messes with your hands. Hands includes water and city of chemical free. Cover your coughs and sneezes. Clean and disinfect your areas, be it at home or at work. Monitor your health. Exercise if you can. Follow medical professional advice. And I put medical professional there on purpose because not every advice regarding COVID that you're going to get is going to be correct. So just rather be on the safe side and follow a medical professional's advice. And then lastly, I said take precautions when traveling. So be it day-to-day or long-distance traveling, take precautions, wear your mask, try and open a window if you can, you know, just protect yourself and protect other people, because it's very important that we do not let this thing get out of hand again, because it has already taken so many lives. Okay, yeah, just let me know if you have any questions. Moving on. Now, this is treatment for COVID-19. So as we all know, COVID-19 does not really have a cure to cure it, but there is different ways that you can treat it. Now, I noted there that it is administered depending on your health. There is no one way to treat COVID-19. And the reason I put that there is because when a medical professional treats you for COVID-19, they do not just treat COVID-19, but they treat the individual with COVID-19. So for example, if you have comorbidities and you have other underlying illnesses, the same treatment that might apply for me as someone who didn't have anything is not going to apply for you. So that's why I put a note there that you do not treat COVID-19 as a one-size-fits-all type of thing. You know, you treat the person with the COVID-19 depending on their health, any underlying issues they have, any allergies they have, because sometimes you get medicine and then you're allergic to it and it makes the situation worse. So you always want to be sure that you probe whoever's giving you or administering your treatment based on your health, because nobody knows you better than you. And you try and get to a medical professional that knows what they're doing, man, you know. And I know that in the public sector, sometimes that does not really apply in terms of good quality service, I guess. But you try and give them as much information about you and about your health as you can, because at the end of the day, it's your life on risk. Now, I listed 4 of some of the treatments that you get. I know it's very hard to read. It looks like just letters put together. So the first one, I'm just going to read the combined word, is Paxlovid. And then we have Veklury. Yeah, it's different treatments for different people. Some people don't even go to hospitals once they test positive for COVID-19. They stay at home and they treat themselves through medicines they buy in your pharmacies, through home remedies. And I'm not saying it's wrong. It works for some people, but make sure that you get medical professionals so that you don't make the situation worse, because it's your life on the line. And really, we do not want to be losing more people to COVID. I think we have had it with deaths pertaining to COVID-19. And I highlighted there at the bottom that consult a medical professional. A medical professional. Not a professional, a medical professional, because we have a lot of people that are professionals, especially in giving advice and administering treatment, but a medical professional kind of not doing in some sense, or you'd like to think they know what they're doing. Okay, and moving on, we're almost done. We're almost at the end of our session. The stats of COVID-19. Now, those were stats I picked up on the 10th of June. I didn't want to do anything on the rush, so I copied this and pasted it, sorry, from the 10th of June 2022. And this was about around 10 to 10 in the morning. So in total, the coronavirus cases that we have were almost 4 million, as you can see there. And then the deaths were over 100,000 deaths that we've had to date with COVID-19. And this is just South African stats, it's not global stats. And then the people who have recovered are also almost 4 million people. Now, I think even though the numbers are not really good in terms of deaths, more than 100,000 people is a lot. But I think we can be grateful for the fact that there are people recovering and there are people that are getting back to the state of health that they used to have before COVID-19. So that is something that we can be grateful for. Because it does not increase. You do not want more people dying from this virus. Now, okay. Now I promise now we're at the end of our session. Now we're going to play a little game, which is myth or fact. Now I have 8 questions here, and I'm actually going to do that so that people can just unmute and give their answers. Please, everyone, if you can just unmute and just participate. I promise this is the end. We have reached the end. It's called myth or fact. I'm going to have 8 questions that I'm going to be asking, and participants can just indicate if the statement that I'm giving is either a myth or if it's a fact. It's based on the information that you know about COVID and what we've gone through today. So I'm just going to ask, because I don't want people to be raising their hands, otherwise it's going to take too long. I don't want to keep you for more than 45 minutes, and we actually quite on time. So if you can, wherever you are, can you just please unmute? I don't mind the background noise, just unmute so that when I do pose the questions, you can just shout out myth or fact, and then we move on to the next question. I don't want it to drag out. Okay. So the first one is COVID-19 can be cured by drinking alcohol. Is this a myth or a fact? I'll repeat it.
Myth.
COVID-19. Liabona says it's a myth. I'm going to repeat it again. COVID-19 can be cured by drinking alcohol. Is this a myth or a fact?
Myth.
Okay, thank you very much. A lot of people believed that actually worked, and by drinking hand sanitizer.
You?
The second one is, yeah, I said the same thing. COVID-19 is a respiratory infection / virus. I'm going to repeat it again. COVID-19 is a respiratory infection / virus. Is that a myth or a fact?
Fact.
Fact.
Fact, you say. Thank you very much. And then the third one, isolation reduces the spread of COVID-19. The spread of COVID-19. Is that a myth or a fact?
Fact.
Thank you.
Fact.
Okay, the fourth one, which I also find very interesting because people thought you can actually do this. And maybe you can, I'm not sure. So you can test whether or not you have COVID-19 by using a thermometer or what other people call a temperature gun. I'm going to go through that again. You can test whether or not you have COVID-19 by using a thermometer or a temperature gun. Is that a myth or a fact?
It's a myth.
Anybody else that thinks it's a myth or that thinks it's a fact? Moving on. COVID-19. COVID-19 is transmitted in cold climate, not hot climate. So you cannot transmit COVID-19 when it's hot. You can only transmit it when it's cold. Is that a myth or a fact?
It's a myth, I think.
You think? Okay. Well, that is a myth. It is not a fact. You can transmit COVID-19 even if it's storming outside or whether it's 100 degrees hot. It's just that it becomes more difficult to transmit the the virus when it's hot. Otherwise, you get cold. Now, the sixth one is COVID-19 is cured by eating garlic and other vitamin C foods or taking vitamin C supplements. Myths. I'll repeat that one because there's actually a lot of comment around it. COVID-19 is cured by eating garlic and or other vitamin C foods or taking vitamin C supplements. Is that a myth or is that a fact? Hello, can you guys hear me?
Fact. It's a fact.
It's a fact.
Yes, I believe it's a fact.
Is there anyone else that has an opinion? It's a fact. Okay. Is there anyone else who has a difference of opinion or would like to second Liabona's answer? And I'm going to go read the question again because there's been a lot of opinion around this. COVID-19 is cured by eating garlic and or other vitamin C foods and supplements. I just need someone else to say it's a myth or a fact so that I know that people where people are in terms of COVID-19.
I'm gonna go with
Questions?
I'm gonna go with myth because you said the question was it's cured by eating. So since there's no cure,
Yes.
I'm gonna say it's a myth.
Thank you. That is actually a myth because yes, I structured the question that way because I wanted to see whether or not you'd pick it up. But it's actually a myth because COVID-19 does not have a cure, but it can be treated by eating these things. It can be treated, but it cannot be cured. And then moving on, just the last two. You can protect yourself from COVID-19 by wearing a mask and vaccinating. I'm going to repeat that question. You can protect yourself from COVID-19 by wearing a mask and vaccinating. Is that a myth or is that a fact?
Fact.
That is that is true. It's a fact because you avoid getting COVID-19 if you're always wearing a mask and you have vaccinated. Does not mean you won't get the virus. It just decreases your chances of getting the virus. And then the last one, I promise, is the isolation/quarantine period has now been changed legally to from 14 days to 7 days. Is that a myth or a fact that the isolation period or the quarantine period has been changed from 14 days to 7 days?